For what purpose does the gentleman from Florida seek recognition?
Mr. Speaker, I move that the House suspend the rules and pass the bill H.R. 2365 as amended.
The clerk will report the title of the bill.
H.R. 2365, a bill to direct the Secretary of Health and Human Services to carry out a national project to prevent and cure Parkinson's, to be known as the National Parkinson's Project, and for other purposes.
Pursuant to the rule, the gentleman from Florida, Mr. Bilirakis, and the gentleman from New York, Mr. Tonko, will each control 20 minutes. The chair recognizes the gentleman from Florida.
Thank you, Mr. Speaker. Mr. Speaker, I ask unanimous consent that all members have 5 legislative days in which to revise and extend their remarks and insert extraneous materials in the record on the bill.
Without objection.
Mr. Speaker, I yield myself as much time as I may consume.
Gentleman is recognized.
Thank you, Mr. Speaker. Appreciate it. Mr. Speaker, I rise today in support of my bill, H.R. 2365, the newly titled Dr. Emmanuel Bilirakis and Honorable Jennifer Wexton National Plan to End Parkinson's Act. And I urge my colleagues to support this legislation. First, I want to thank Chairman Rogers for her support of this bill and passing it out of markup last week unanimously by a vote of 47-0. I'm also grateful to my good friend and colleague on this bill, the co-lead Representative Paul Tonko, for his support and for working with me on this particular piece of legislation. Mr. Tonko has been a true partner in this effort to provide hope for patients living with Parkinson's disease, and I commend him for his advocacy on behalf of the community. In that spirit, Mr. Speaker, the Michael J. Fox Foundation has been a champion for this mission to fund research for better treatments and cures for over 23 years. Michael J. Fox has been able to use his own diagnosis and celebrity status to channel into over $1 billion for translational research. We have a letter of endorsement from his foundation and 30 other Parkinson's neurological advocacy groups and organizations, and I truly could not thank them enough for their support and grassroots efforts on this particular bill. H.R. 2365 is no-cost legislation. Again, I want to repeat, no-cost legislation that will unite experts from government and the private sector to develop a national Parkinson's project with the goal of preventing, treating, and ultimately curing Parkinson's disease. Parkinson's affects almost 1 million Americans nationwide, and it is the fastest growing neurological disease with no cure available, unfortunately. It costs our healthcare system over $52 billion annually, and that number is projected to increase over the next decade to $80 billion. We must do all we can to change that trajectory. Sadly, many of my close family members, Mr. Speaker, are among those who have been diagnosed with this horrific disease. This year in particular has been very difficult for my family as I lost my brother, Dr. Emmanuel Bilirakis, to Parkinson's disease in May. As a primary care physician, my brother cared for his community and his family. He really did, and I'm so thankful that my friend and colleague, Anna Eshu, she's a godsend, suggested we rename the title of the bill after him in his honor, and for her strong support on this bill. My brother was an outstanding individual, in my opinion, a saint, and may his memory be eternal. Further, my mother-in-law, Theodora Dialios, also passed away just this past October after a years-long battle with the disease. She was a strong and wonderful woman. My uncle also had a diagnosis and passed away a few years ago. And my father, Congressman Mike Bilirakis, who was chairman of the Health Subcommittee under Energy and Commerce, Peter worked with him. He was diagnosed just recently. So this is for you, Dad, as well, and all of my constituents. Given these personal connections, I have made it a mission to enact legislation that will help Parkinson's patients around the country. And H.R. 2365 is the first step in that direction. Thankfully, we have been able to come together in a bipartisan fashion to move this bill forward, and I'm hopeful we will get broad bipartisan support in the House today, Mr. Speaker. This could also not come at a more critical time, as earlier this year, researchers were able to newly discover a Parkinson's biomarker that will help reveal pathologies and provide better understanding in research and development efforts. I truly believe we are on the brink of new breakthroughs for treatments and cures, and that one day we will completely eradicate this dreadful disease. But we must be proactive, and we can't afford, none of us can afford to wait any longer. This National Parkinson's Project will provide an integrated strategy to support and coordinate research efforts, collaborate to prevent duplication, encourage development of safe and effective treatments, and review the impact on patients and their caregivers and families. With passage of this bill, Mr. Speaker, HHS will be tasked with the creation of a new advisory council comprising of experts in the field across the federal government and every related agency, combined with non-federal, this is how you do it, public-private partnership, non-federal appointed members represented by the patient advocates, specialist providers, clinicians, and researchers working in the Parkinson's space. This advisory council will focus its efforts on an annual report to the Secretary and to Congress with an evaluation on the current efforts to prevent, treat, and cure Parkinson's once and for all. It will also provide recommendations for ways to reduce the escalating burden of this disease on patients and families, the caregivers, Mr. Speaker, including ways to reduce costs, improve health outcomes, and quality of care for Medicare and Medicaid beneficiaries and our nation's true American heroes, our veterans, and better research, again, researching the underlying causes of this terrible disease. Lastly, H.R. 2365 will incorporate other neurodegenerative Parkinson's-related diseases, including the rare disease progressive supranuclear palsy, PSP. PSP is an extremely aggressive disease that progresses rapidly with life expectancy of 6 to 9 years after diagnosis and has no known cure or cause. But like Parkinson's, we can change that if we act now. I was so saddened to learn that our friend and House colleague, Jennifer Wexton, was diagnosed with PSP. Our thoughts and prayers are with her and her family, and her bravery is to be commended for continuing in Congress on behalf of her constituents by battling this horrific disease. She did so much. Again, Mr. Speaker, I thank her, Representative Wexton, for her support. I couldn't do it without her. Bipartisan support. Again, Representative Wexton for her support on this effort, and we are absolutely honored to be able to add her name to the title of this legislation as well. In the end, there has never been a better time to move forward with H.R. 2365, the Dr. Emmanuel Bilirakis and Honorable Jennifer Wexton National Plan to End Parkinson's Act. I want to thank my good friend and Majority Leader Steve Scalise for helping put this bill on the suspension calendar this week. We really appreciate it. Accelerating the process. It's a no-brainer. We've got to cure this disease as soon as possible, save lives, and again, quality of life is so very important as well. Let's do the right thing for the Parkinson's community by getting this bill through the House floor to the Senate and enacted into law as soon as possible. Thank you so very much. I urge my colleagues to support H.R. 2365, and I reserve the balance of my time.
Gentleman reserves.